Dr. Eric Abbott. Welcome back on the Veterans Voice podcast. This is twice now. How's it going today?
Good. Thank you for having me back. I appreciate it.
Yeah, absolutely. We had some great conversation last time. My intent here is to get to know you some more because you're a pretty awesome person. You got a pretty legendary resume, and you also have a plethora of information relevant to the veteran community. So just want to get you talking about some relevant topics, loneliness, anxiety, depression, PTSD, what that looks like in getting care with your primary care. You're a provider for Optum, so a subject matter expert on this. So let's just go back into your story real quick just so people know who you are. But tell us a little bit about your medical, your medical journey. How did you start? I know it was in the military, but moving forward into medical school and now Optum.
Absolutely. Yeah. Well, grew up in Colorado Springs, so military family. Spent a lot of time around the Air Force Academy. I was actually there as a pediatric patient, and I went to high school on the Air Force Academy and went to undergrad in the local area, so Colorado College, and then decided to give the Air Force a try. So went to officer training school back in 1997, and I was in the logistics career field for about 6 years, ended up in New Jersey, and decided to cross over into the medical career field. So I applied to med school.
Yeah, if I remember correctly, your father his advice was join needs of the Air Force.
Correct. Yeah, I was asking which career field I should pick, and he said needs of the Air Force. And
great.
By God's grace, I was selected for logistics and not security forces or like EOD or something like that.
For sure.
So. Yeah. So I ended up through the HPSP Health Profession Scholarship Program doing med school. Got that all paid for. It was a multi-step process, not as easy as it sounds, but got that all paid for and ended up at a civilian medical school in New Jersey, and then sponsored by the military. And then I ended up subsequently here in the Colorado Springs again at Peterson Air Force Base as a flight surgeon.
Awesome.
Did that for a couple of years, and then I went to a military residency in Nellis Air Force Base, Nevada.
Okay.
And then after that, I was primary care, active duty, and did that for my remaining time. So total of 25 years if you count med school and internship.
Yeah, and it sounds like you come from a family of service as well. Like you said, your father was security forces in the Air Force, and brother attended the Air Force Academy. What did he end up doing?
So he ended up actually majoring in political science, but he ended up doing nothing to do with political science. He was space operations, and he did that for a short stint and then got out. He was kind of done with
for sure
with the military.
Yeah. Well, today you work for Optum. You're a provider for Optum. Let's get in a little bit about how you guys are incorporating mental health, behavioral health treatments into primary care. Like, what does that look like? Because I don't think, that's common. And I know you guys are kind of getting ahead of the curve here, but incorporating mental health services into primary care, just go ahead and explain that a little bit, because I don't know a whole lot about it, and I don't know what that would look like, but it seems extremely beneficial to me.
Absolutely. Well, often in my experience, seeing patients, a lot of times patients will walk in, they'll sit down, I'll ask them how things are going, and within 5 minutes or less, they're telling me about their mental health struggles, to be honest, and I have to kind of circle back and remind them, but why did you actually come in today? Oh, I needed a refill of this, or I have this pain or this ache or whatever. But we tend to, at least in my clinic, my patients feel really comfortable with going straight into their mental health issues, and it's always been that way. It was like that when I was a flight surgeon, believe it or not. So I realized that at least 30 to 50%, I'm just making up a statistic. It doesn't come from anything. But I would say probably 30 to 50% of the patients that came in to see me that was actually the reason why they were coming in. Sometimes they didn't know it until they were actually talking to me. And they found themselves crying, or they found themselves opening up about their marriage issues or their work issues or whatever it happens to be, issues with family. So the really cool thing with Optum is that enough people have realized in that environment before I even got there that there's a huge calling and a need for mental health evaluation and treatment in the clinical setting. The statistics apparently state that if someone commits suicide, for example, there is a significant percentage of people that had visited their primary care physician within the preceding month, 30 days, something like that. So when people are really struggling and having issues and they don't know where to turn, and they don't turn to clergy, sometimes they turn to clergy or friends, family, whatever,
Right.
but in a lot of cases they turn to their primary care physician, and because that's just instinctively where they go. And so that gives us a wonderful opportunity to grab onto that and to say, hey, I have a team available, mental health team available here that I can refer you to, who can see you shortly, and they can sit down, talk to you about what's going on, help to begin your evaluation and treatment process, get you referred to maybe a subspecialist if necessary. Maybe you need to see a psychologist, a psychiatrist. Maybe it's just a therapist, social worker, or whomever, but they can get you directed, and you can get captured before you leave the clinic with me. So I'll walk that person right up to the front desk and have them get scheduled with behavioral health before they leave, even though they ostensibly came in for a diabetes follow-up or for an ankle twist or whatever it is. So
Well, I think that says a lot about you as a person. I just like getting to know people in here. If people have been open up to you your entire medical career, that says a lot about you. So good for you. Because I know it's not easy to open up to just anybody.
Right.
So you're clearly a very approachable and conversational person. But it makes sense that you would go to your primary care for this type of issue because, it's something wrong with us. I don't feel normal and I don't know what to do. I should go to my doctor. But at the same time, it doesn't seem like something you would go to your doctor for because it's invisible. It's not like you have blood work that's faulty. It's not like you have a broken bone. It's not like you have a rash. It's invisible wounds. And that's what we talk about here all the time. So how do you as a provider help in that situation if it's not something visible and it is some kind of invisible wound?
Well, a lot of times that's exactly the case. Someone will come in saying to me, I'm not sleeping, or I'm experiencing difficulty with responding to my wife, let's say, or I have anger issues, stress issues at work, and my productivity is down, and my boss is angry with me, and they're giving me the evil eye in the hallway and all this other kind of thing. Or they're just dealing with hypertension, they're dealing with, their blood sugars are out of whack, or they're getting sick frequently. I often bring in mental health into the equation. And I'm a DO, so that's for anyone that doesn't know what that is. That's a doctor of osteopathic medicine. What is a DO? It's the same thing as an MD, but we get additional training in musculoskeletal diagnosis and treatment and things like that. And then in addition to that, the DO philosophy is very holistic. It's very whole person oriented, sort of mental, emotional, spiritual aspects of a person, because they're all connected and interrelated. You can't set aside the physical from someone's mental and emotional and spiritual life. You just can't do it. So I find myself asking that question all the time. How are things at home? Are you sleeping? How's things going on? Or how are things with your wife? How are things with your kids? How are things at work? And more often than not, that opens the floodgates. And then I can say, hey, I really think that underlying this chronic pain that you're having in your chest or your belly or whatever, after we rule out organic causes, obviously, well, we're going to do that, right? I'm going to get them to see cardiologist. I'm going to do an EKG. I'm going to get them to GI. I'm going to order whatever imaging and labs and things that I need to do. But if a lot of these things are negative, or even before, meaning normal, or even before we get all of this stuff going with them, I'll let them know, I think there might be a mental health component here. And I think you might have potentially some unresolved trauma from childhood, or you may have potentially some unresolved combat trauma. And a lot of times they open up to me and they're like, you're absolutely correct. And I thought I was over it, and I'm not. And you could have something there. And then we kind of integrate that into their overall treatment plan.
What do you do if you meet resistance there, but you're pretty certain? Like, let's just say, I'm a soldier. I was Sergeant Smith. I deployed 10 times and I have anger issues, but you're my doctor and I swear it's not because of that.
Right.
I hate my job.
Yep.
but I'm just so angry. How would you approach that?
Yeah, no, great question. I run into that sometimes too. And I find from my vantage point, it's all about planting the seed, right? So the most important thing in my practice that I've noticed, or just medical practice in general, but I only know my practice, is that the patient has to know that you care about them. You can't fake caring about somebody. But if you do care about someone, they can feel it and they know it. So I try to treat every patient as my brother, my sister, my father, my mother, my grandfather, like a family member or a really close friend. I give them unconditional positive regard. I give them unconditional love. That's the way that I interact with them. So then when I let them know that, hey, I think this is going on, even if I get resistance from them, I know that if I communicate that message to them with a sense of caring, with a sense of love, that will stick with them. So they're being reactive in the moment, but they're gonna think about it later.
Right.
And I've had patients come back to me later and they're like, you know what, doc, I thought about what you said. And as it turns out, like, you're the first person that's listened to me in 20 years.
Right.
And you absolutely hit the nail right on the head, but I didn't want to accept it in the moment. Or I had been thinking the same thing, doc, but I felt ashamed and I didn't want to talk to anyone about it because, men are not supposed to have mental health issues. Isn't that right? And I'm like, yeah, that's what our society says. But as it turns out, I deal with mental health issues and I open right up. I mean, I've had my own struggles and issues with that. So I have no qualms about opening up to patients, letting them know. And that drops a lot of barriers.
Right.
You can see their face change when I open up to them like that. And I don't I try not to overshare. But I'm just like, don't feel like I'm on my high horse saying, hey, I think you're dealing with anxiety or I think you're dealing with PTSD or whatever, because I've dealt with my own issues. And their eyes get big and they're like, but you're a doctor. And I'm like, yeah, so what,
Yeah, I think that's perspective is very important. And if you can change someone's perspective on something from your standpoint, from your experience, from your story, that's almost priceless in my opinion. But we've talked about, physical injuries and then invisible injuries. Let's tie the two together because this is super relevant in the veteran community, but in humans is in general. If someone does have something like diabetes or maybe something more serious like, they're missing a limb or just a newly diagnosed physical, condition, something that you can measure, whether on blood work or by, visualizing it, how does one affect the other? I recently had a family member who was in the hospital for almost 2.5 months. And there was a hiccup in the surgery. They had left something in there. They had to go back in. He got an infection. It was a very drawn out process that was unnecessary. And he still struggles with these feelings of something is still going on. Something is still happening in me. I'm going to end up back in the hospital. But I don't think he understands it as a behavioral health issue. This is a mental health issue now. You went through something that caused this feeling. You're not having this feeling because of, I have a hard time explaining it really in-depthly, but I feel like you know where I'm going with it. What would you say on that topic?
Absolutely. Well, there is, I don't know if I can mention a name so there's a Canadian physician by the name of Gabor Mate, and he's written a lot of books about addiction medicine and about just general health. He's a primary care physician. So, and he does a lot of writing and talking about trauma. And he says that the way that you define trauma is that you can have an event, let's say, and you have two people that are going to have their responses to an event. Let's say it happens to one person and it passes through them and they just go on about their lives and there's no after effects for them. Then that person didn't really experience trauma because it didn't affect them. But so the definition of trauma is that it affects how that particular event affects how you meet the world from that point forward. It affects how you see the world, how you interact with the world, how you interact with yourself, and it has a very specific, well-defined effect on you that you can place your finger on. And so you can't say necessarily, oh, because I didn't go to combat, I didn't experience trauma, or because I wasn't in this particular situation or that particular situation that I didn't experience trauma. So certainly combat trauma is extremely legitimate, the most legitimate, I think. But I'm saying that a lot of times that's what they're afraid to speak up because they did not go to combat or because they were not in the direct line of fire or something like that.
Right.
So therefore my experience is invalid. Do you see what I'm saying? So just an example of what you're talking about. So having a major surgery, especially having an instrument or a towel or something left inside of you, and they have to go back in and pull it out. Your body remembers that. Subconsciously, you remember that, and that is a traumatic event, and that may affect you moving forward into the future. So addressing those mental health issues is just as important as addressing the physical issue. And it's like that with really any disease process. But behavioral health embedded in the clinic is supposed to also help us specifically in that way. So people dealing with diabetes, people dealing with asthma, people dealing with weight issues, we are encouraged to get behavioral health on board as well, because that's a lot of times a part of why they're dealing with these disease processes in the first place.
Okay.
Especially self-medicating, right? People that drink a lot because they're dealing with underlying stuff, and that develops into kidney disease, or that develops into liver disease, they develop pancreatitis or something going on with their gallbladder because of that, and then that causes diabetes because their pancreas was damaged, and so on and so forth. And you're like, well, what was the root of their diabetes in that case? Well, it was actually self-medicating from an alcohol intake issue. Just one example.
Yeah,
it's
this is a very multifaceted example, though.
Sure.
But in the diabetes, the diabetic example, you have diabetes. No one tells you like what the psychological effect of that is going to be. You have to now do this injection every single day. You have to eat this diet. You have to do this. You have to do that. There's so many changes, and now you're thinking about all this stuff. That kind of sounds like anxiety. You're kind of angry that you have to do this for the rest of your life now. That sounds like depression. Like these are all mental health or behavioral health issues that come along with the physical issues that no one's talking about. But it sounds like you guys have nailed that in your primary care. Am I wrong?
Absolutely. I mean, because there's denial, right? There's hesitancy or hesitance to take one's meds out of denial.
Ooh, that's a good point.
Or out of feeling ashamed. Oh, I'm a diabetic because I did something wrong. I'm letting myself down. I let my family down. I let my wife down. She told me not to eat X, Y, and Z for the last 5 years, and I didn't listen to her. And now I've done this to myself, and I'm sick. And what if I lose toes and my foot? And what if I lose my vision? What's going to happen to my family? And there's a huge mental health component to all that stuff. Absolutely.
So let's talk about treatment. I know we kind of touched on it a little bit, but more specifically, what happens if this kind of stuff goes untreated? The person who's in denial, what if they just continue to deny it and these depression and anxiety symptoms I'll let you explain it, but I would presume they compile and not get better.
That's absolutely what happens. It snowballs, and then they find themselves in hospital. That's essentially what happens. So that's our primary job in primary care is prevention, right? And so if we can prevent people snowballing like that by fixing them, so to speak, mentally as well as physically, then they'll keep themselves on the rails instead of going off.
If we could just expand a little bit more, because, we touched the veteran community, you guys touched the entire community, but just explain how no one is immune to this type of issue. Like you said, you've struggled with mental health. I spent 13 years in the Army, and I can sit here and tell you I've struggled with mental health. Just give some perspective from your story that everyone, like, no one's exempt from this and everyone can experience it.
Oh, absolutely. I mean, I saw it all over the Air Force. Certainly the armed forces in general, Army, Navy, Marines, there's tons of mental health issues there, just secondary to people being separated from their families or being deployed or just ops tempo, workload, working, lot of nights and weekends, depending on one's leadership position and various things that are going on. So there are a lot of people that are really burned out, not only in just the military, but everywhere, right? But the military is that environment, very sort of very macho, very nothing can hurt me, and you're encouraged not to speak up. That has changed a lot in recent years, but for a long time, people would come into your office, let's say if you're in a leadership position, shut the door, and they would talk to you about what was going on with them. But the end of that conversation was always, please don't mention this to my flight chief. Please don't mention this to my commander, because if anyone finds out about this, then I'm going to get pigeonholed. I'm going to get kicked out.
Right.
And then I'm not going to make my retirement. I'm not going to get my VA benefits. My family's going to starve, whatever. These last 12 or 15 years will go to waste because I'm not going to make it to 20, that kind of thing. And that way of thinking and that fear was absolutely present even with me. I was in a situation where I was dealing with some mental health issues that honestly had been present since I was 8 years old, and I did not know it because, like I said, I come from a military family, very type A, very focused, very hardworking, very Spartan. You know what I mean? So
respect.
Absolutely. So it's like the solution to any problem is to work harder.
Yeah.
Right. So if it hurts, then you push harder. If you get tired, then just you dig and you just keep pushing. That's just how you deal with pretty much anything. And if you're feeling sad, I guess to use this word, anxious, whatever, then it's by definition it's your fault. Either you left something undone, you didn't think of something, you didn't prepare enough, or you're weak. And I bought that up until I was well into my military career. I didn't realize until I was well into my 40s that there was actually a mental health issue going on. I had no idea.
How did you see it show up?
I was in the clinic. I was in the clinic, and I was. It was a very high tempo, high paced clinical environment, and I had this way of showing my anxiety that only someone with a sharp eye would be able to really tell what was going on. And I won't get into too much detail with it. It was nothing inappropriate, nothing crazy, but it was almost like a nervous habit that I had. Let's put it that way. And seeing anyone else do this mundane thing, you would think nothing of it. But that particular thing, and it could be something like taking a drink of a glass of water, or it could be, a certain thing that you do at your desk or whatever. It was that kind of thing. Right. You see what I'm saying? Yeah. But my flight commander at the time was very observant, and she observed me over a long time, and she pulled me aside and she's like, you're not okay. I can tell that you're this action that you're doing is actually a nervous compulsion, and you've got all this pressure built up in you, and you're dealing with a mental health issue. You're dealing with really severe clinical anxiety. You need to go be seen at the clinic at Fort Belvoir. I was I was stationed at Andrews Air Force Base at the time, and I was recommended to go to Belvoir and talk to mental health. And I was so grateful to her that, number one, she was paying attention. Number two, that she would feel open enough to say something to me. And then number three, she was very non-retributional about the whole thing. She's like, you're not command directed. This is me just caring for you and telling you what needs to get done. And so I went, and I was in denial. I was 100% denial. And the first thing I said to my therapist, I guess you could say, or psychologist that I was talking to, was, I never let this affect my patients. Like, my patients are squared away. They are 100% taken care of. And they're like, yeah, we believe you. We're like,
yeah, is that part of it?
Yeah, we're like, we have no doubt that your patients are squared away, but are you squared away? And I was like, well, no, but that's not what's important,
And that's exactly how you ended up there, though.
Correct.
You were focused on the work. I envy the Spartan mentality. I would probably identify as well.
Yeah.
But have you noticed, you said it was in your 40s, but have you noticed when you took care of this lingering issue that you are now more fueled to do your Spartan, activities? Would you say, like, taking the time, I don't know what your schedule is, but like I enjoy meditating every evening, at least 20 minutes. I just need a period of time throughout my day where I just take a second to myself, no music, no, just silence.
Right.
And I just think about what's going on.
Yep.
And it, control your breath, control your heart rate, just get real calm, go back to homeostasis, because we all know that, the world right now is not very advantageous to be in a homeostasis environment. But how did that benefit you? Because you are a hard worker, you are a high performer, and that's what we talked about on our previous podcast. How has, maybe taking a step back or taking a step down helped you get higher?
Absolutely. I mean, it was a game changer for me, because I realized that I was not performing at my fullest potential or at my highest potential. I was a high performer, relatively high, right? I still had plenty of room for improvement, believe me.
I appreciate you being humble, Eric.
well, no, it's true though, because there were some gaps and there were some deficiencies in my productivity in terms of like paperwork volume and things like this. Do you know what I'm saying?
Yeah.
Like there were definitely chips in my armor. There were definitely dips, no doubt.
Understood.
But at the end of the day, like all the important stuff was done. Do you know what I'm saying?
Yeah.
There's so many opportunities to miss something in that kind of environment, because there's always computer-based training to do. There's always a physical fitness test to prepare for. There's always a chemical warfare training to do. You know what I'm saying? There's always something
always
that
more.
Yeah. So when I started, seeing a therapist, and I was definitely taking some meds, so I was really resistant to that. Wanted to do, I was dragged kicking and screaming nearly into that idea, and they're like, just give it a try, just give it a shot. And I'm not saying to people out there, you have to be on medications, but for some people, SSRIs are really, really beneficial, because some of us our brain chemistry is such that we have a deficiency of dopamine or serotonin or norepinephrine or whatever it is, And like I said, I didn't know that I was dealing with a deficiency of serotonin until I was in my 40s. So the combination of the medications, the counseling, and then love to work out. So, but the running, biking, swimming, and weight training wasn't enough, right? I needed to, in fact, I was just wearing myself out, but still wasn't addressing the mental health stuff. So adding that on, plus just daily prayer, daily meditation, it's like I can go into the office now and really connect with my patients and just knock it out of the park. And it doesn't mean I don't get tired. It doesn't mean I don't have bad days. Of course I do.
Right.
Of course I do. But I'm a much more functional person now than I would have been otherwise. In fact, I would have perished, to be honest with you. I wouldn't still be here if I hadn't gotten my stuff addressed.
Interesting.
Yeah, I wouldn't be here still. So, and that's not being morbid. That's just, when I say here, I mean not necessarily I wouldn't be on the planet, but I would not be probably practicing medicine. I wouldn't be doing this podcast. I would be probably squirreled away somewhere.
Yeah, no,
isolating myself. You know what I'm saying?
No, I totally know what you're saying.
Yeah.
I'm trying to give a good response here. It's hard to, I feel like it's a common excuse to say I don't have time for that kind of stuff. I don't have time to meditate. I don't have time to work out. I don't have time to do this. I don't have time to do that. We don't have time to do all the things we need to do for some reason, because we're so fixated, in your case, on patients, on med school, on, being the best flight surgeon you can be. We're just focused on all those things. But what we really need to understand is, in order to do all those things well, exceptionally well, you have to pull back and turn the volume down for an evening so you can turn it back up tomorrow. If we never turn it down, we're going to blow our speakers out. You know what I mean?
Correct. Correct.
And yeah, that's so important. And I feel like we talk about this almost on every single episode, but I don't know how to explain it in a way that, I'm trying to explain in a way that just makes it click for people. In order to excel in life, you have to turn down at times. And in my opinion, every single day. But,
Every day.
It's good. Sunday afternoons, I don't plan anything, man. Like my Sunday afternoon, I'm going out with the family, with the dogs. We're going out to the mountains. We're doing something. Every evening, I do a meditation. I do some stretching. I at least just take a moment to myself to just think about the day and think about tomorrow. So maybe just explain it, from a provider perspective, how important this really is.
Oh, that's extremely important. I mention to patients all the time, full well knowing that they may think I'm like really woo, you know what I mean? Like really far out there, or just like, a hippie in disguise or whatever. Sometimes I joke with them and I'm like, I'm a hippie. I don't look like one, but,
Me too.
under the type A exterior,
Right.
And, I told them exactly that. I recommend meditation. I recommend yoga. I recommend, I do Qigong.
Okay.
I don't know if you're familiar with
I'm
Qigong.
not. What is that?
It's like Tai Chi. It's
Okay.
it's a Chinese internal martial art that entails just sort of visualization and breathing and movement. And Tai Chi is really difficult and complicated and way over my ability level. Qigong is like the play school version of Tai Chi.
Okay.
It's way easier.
The idea is just body awareness.
Correct. Yes, body awareness and just kind of like energy flow and things like that. And as woo as that sounds, I can definitely tell a difference in my performance, my executive functioning, my ability to switch between tasks. And I don't have ADD, but I'm just saying like my ability to do that is just totally supercharged if I've done something like that. I can work longer without having to drink or eat. The stress level is down. My ability to focus is enhanced. That kind of thing. And I'm not plugging necessarily that people have to do Qigong, but anything that can bolster your sort of like resetting your mind and body, right? Because what stress does is that it shuts off your frontal lobes. So your frontal lobes is kind of where your executive functioning is. And when you're too stressed out, it shuts off your ability to reason, to think, to focus, to switch between tasks, to really operate at top efficiency. So anything you can do to reset that, whether it be going out for a walk, like you said, in the mountains, reconnecting with nature, right? Relaxing and watching a podcast, or meditating or stretching, doing some yoga, spending time with your pets, with your family, anything to kind of unplug for a bit that helps to reset the brain. And you're going to come out of that so much more functional and able to do what you need to do.
It's definitely not the norm to do this, but I know like, you leave for work at 8, you get there at 8:30, you work a 9 to 5, you get home at 6, and you're just kind of on this grind all day.
Yeah.
In my opinion, if you have like a lot to do, if you take 15 to 20 minutes to just reset right before you do that, for example, I have 2 hours, 3 hours, I need to write this paper. Right. Instead of just diving into it because I'm nervous about getting it done and I just rush through it, take 15 minutes and go walk outside, go talk to a friend, go build a relationship, and then come back and sit down. And I can tell the difference. I can for sure tell the difference. I feel like it's a cheat code when you do that, because then you can really, I'll get it done in an hour and a half now because I just reset my mind, drank some water, got some calories in me, and then I sat down to do my hard work.
Right.
So I'm sure you implement this on a daily basis.
100%, but it took me a long time to figure this out, and I'll still overdo it and push it too hard and not take breaks and wear myself out and stuff like that. I learned this from a buddy of mine in med school who took more breaks, would unplug each day after studying and go to a movie or read a book or whatever. His grades were way better than mine.
Yeah.
And it took me until probably several years after med school to even realize what had happened there. I was like, wow, he's a smart guy, but I always thought, oh, he's just smarter than me, or he's just, you know what I'm saying? He's not as distracted as I am because I'm worried about this girl, this relationship or this situation or whatever it is, which there's some truth to that actually.
For sure
but No, it was his ability to unplug and to give himself a rest. And I thought that was wasting time. And I thought that was goofing off. And that was not tantamount to really having your nose to the grindstone and doing what you're supposed to be doing. You're goofing off. As it turns out, like that's not the case at all. And you need balance.
Yeah. The theme of this conversation has been do less to do more.
Correct.
Both on a macro and a micro scale. Like in your day-to-day activities, take a break before you go do that, 3 hours of work. And on a big scale, take Sunday afternoon to reset before you attack this entire week. And when you start doing this on a micro and a macro scale, it just makes for a much more balanced life.
It really does.
A big part of this is community and relationships and avoiding loneliness. And you sent me some really interesting statistics here, which I would love to get into the weeds about. Loneliness can cause severe health issues. Absolutely. Not just, I'm sad, I'm depressed, I don't have any friends, but from heart disease to stroke, I'm sure there's a bunch more that you can talk about, but let's talk about the dangers of loneliness.
Well, it's an epidemic,
right?
Actually, probably worldwide, but absolutely in the United States. And there are a lot of people that are researching it now and writing books and doing podcasts about loneliness in particular. And it changes the wiring of your brain and makes it more difficult for you to just sort of get back to equilibrium. It's almost like it puts you in a maybe like, don't quote me on this, but it's almost like a perpetual fight or flight, sort of mode.
If you're alone,
if you're isolating yourself and you're experiencing loneliness, it's almost as if your stress hormones are up as a consequence of that.
That's interesting.
And they stay up.
Yeah.
Do you see what I'm saying?
Oh, I totally see what you're saying. I want you to talk more about it. But people are isolating, are lonely because maybe they're lazy. I don't want to do any work. I'm just going to sit here and relax. It feels good to sit here and relax. And then you do that for a week, month, year, and this is now your lifestyle.
Right.
And now you're telling me this is like inducing a fight or flight response. Tell me more about that.
Well, and I don't want to misspeak. It's that it has that same sort of negative effect on you as a chronic or perpetual fight or flight response, where it starts to change your wiring. So there's actually a higher incidence of dementia in people who are chronically lonely. There's supposed to be a 29% higher likelihood of having a heart attack if you experience prolonged or protracted loneliness, and a 35% higher likelihood of developing a stroke.
Can I'm going to try and explain why, and then I want you to correct me. My idea is if you're spending time alone, we're, humans have been around for a long time. We're pack animals. We need to be around other people to know we're safe,
right?
Or else we get lost in our own thoughts. And most common, it's fear and anxiety. And if we're not around that, and if we don't have a community around us, friends, coworkers, family, we're fearful because we don't have anything to run ideas off of. So we kind of, default to fear in that situation. So if you're alone and you don't have a big community, you don't have a big network, you have this stress hormone flowing, probably cortisol flowing in you more than if you were around other people.
Correct.
Years of that would cause heart disease, stroke, and just other health issues. Am I in the ballpark?
That's absolutely correct. And that's why we treat, for example, sleep apnea, which seems like really divergent from what we're talking about, but that's exactly why we treat it, is because when people are experiencing sleep apnea at night, it's the physical equivalent of being waterboarded, right? Someone holding your head underwater.
Yeah, you have a lack of oxygen.
Yeah, and so your body releases stress hormones, and then the chronic release of those stress hormones over time can actually damage your heart.
Wow.
And end up causing heart attack and things like that. So kind of a strange sort of comparison, but it's the same sort of thing. So if you have uncontrolled depression, anxiety, PTSD, things like this, and then the natural consequence, I should say, of dealing with a lot of those is isolation. That's the default sort of mode, especially for really type A driven people that are
on a path.
Is that they don't want to be seen that way.
Right.
So they're like, I'm gonna pull in, and I'm going to deal with this on my own. And once I'm good, then I'll reemerge.
Yeah.
And actually it just gets worse because you're isolating yourself.
There's no way this is a common thought. There's no way people think about this. I've never thought about it this way, but like literally being lonely, withdrawing, dealing with your own problems because you're strong, independent man or woman can be causing real health issues.
Oh, yeah, absolutely. And I was even discussing with a therapist recently. So like seasonal affective disorders is actually a real thing.
Yeah, I was going to get into that next.
Yeah. And I actually, I mean, full disclosure, like I deal with that myself every year around the same time. It's almost like clockwork, November 1st. And it's like I'll start feeling kind of funny, and it's before the time change. That's the thing that's weird. You would think that it's just because we switched our clocks. It's like, oh, it's because of that.
Right.
That doesn't help, but it's actually a visceral sort of palpable feeling that can come over you like around this time of year. And I don't really know what it is. And did not know, once again, I can be really slow on the uptake sometimes. I didn't realize that that's what I was dealing with for several years. And then finally it dawned on me like, oh, so this is why you feel like trash like every year around the holidays, And I'm trying to remember why I brought that up now because I just went on a tangent.
We're talking about like the actual legitimate health issues that come along with these symptoms.
Yeah.
The stress hormones that are flowing unnecessary, like excessive cortisol because you're just alone and don't have any confirmation in, happiness or loneliness. So you just default to I'm scared of the world. But yeah, if you wanted to, if someone's suffering from, the holiday blues, if you will.
Correct. Explain
how this can literally cause health issues.
Thank you for putting me back on track.
Oh,
I pulled myself off. So that
I love getting sidetracked, so it's totally fine.
Right. So when you're dealing with this seasonal affective disorder, which it doesn't necessarily have to have that stamp, right? You can call it holiday blues, you can call it the winter blues or whatever. It's a variation of the same thing. The natural response, the natural inclination is to withdraw, especially because it's cold outside and the roads can get bad and things like this. So it's like it's easier just to sort of pull in and I was talking to a therapist recently about that, and he said that the way to address that is that you have to do the action first, and then the positive mental emotional benefits will come later. So you don't wait until you feel like doing something like leaving the house and taking the dog for a walk or taking your wife to dinner or whatever, and then once you feel like doing it, you do it because you're never going to feel like doing it. So if you're struggling in this area, so you go do it first. You practice self-compassion, obviously. It's not like you're trying to put yourself in the most uncomfortable situation you can find and whatever, but just baby steps, right? So if someone invites you, let's say, hey, let's go get a cup of coffee. Wow, I really don't feel like it, and the sky is gray and it's kind of cold out and I'd rather just stay in bed. And well, try pushing yourself to go meet with them. You know what? Let's meet for half an hour. Like it doesn't have to be that long. And you'll find that once you're out, you start feeling a bit better. And then when you get back, you're like, oh, that was actually better for my overall mental health to have gotten out of the house today.
Absolutely.
Like now I can do my reset activity for the week or whatever it is, and then you're going to find yourself in a better space to get back to work.
Right.
If you isolate yourself throughout the whole weekend, then you're actually not going to be as productive the next week.
I could see how this could show up in someone who is, on a path pursuing a goal, because you might put in 5 days of work, 12, 14 hours a day. Like, I'm going to take a down day. I need it. And like by that evening, you I'm falling apart. What am I doing with my life? Like I did that this week. I did that yesterday. I had a really busy Saturday, Sunday, Monday, and Tuesday, and I took Wednesday to chill. And by the afternoon, I was like, I got to catch up on this. I got to do that. You relate with this?
Absolutely. Oh, absolutely. Yeah. I had a COVID flu vaccine on Friday, and I tend to respond pretty strongly to those. I just feel sick for a few days, So I was out for the weekend, just kind of laying low, and then Monday rolled around. I still didn't really feel well, and I deliberated with myself for hours ahead of time. Like, is it, should I take PTO, paid time off? Should I not? Like, am I going to be viewed as lazy by by the boss. She knows me, so if she hears this, she'll probably be laughing. She knows how I'm wired, you know.
Yeah, for sure.
And so I finally ended up. I even consulted several friends of mine. Hey, do you think I should take the day? And they're like, you're crazy. Like, of course, take the day. Like, if you're not feeling well, I don't understand what the question is. You know? So I took the day, and then what was the first thing I did? I opened up the laptop and did a bunch of work for like 3 or 4 hours. And then once I had earned it, then I could unplug and relax.
Yeah. And even then, like, I'm still thinking about what I have to do when I'm done relaxing.
Correct.
I totally get it, man.
So it's a constant battle, you know, with yourself, because I think like, oh, you know, you're slipping, man. You're slipping, you know. It's like, no, you're not.
Yeah.
It's okay.
We've kind of covered it all, but you have any advice for someone like that? Like, I don't know. I'm thinking about the veteran who is using his GI Bill and he's in college right now and he's taking on, you know, 3 classes, 4 classes, and he just is grinding.
Yeah.
How do we communicate that it's important to turn off and reset?
I would say that it's about self-compassion, right? So there are so many good people out there that want to do good things in the world, and they are just really hard on themselves. And it could be just, you know, voices from childhood and maybe some negative influences along the way. And people can be really self-critical, and they can push themselves really hard and sometimes too hard and things like that. So it's really about just scheduling some time, setting some time aside. And it's, of course, the work needs to get done, but it really is okay to just take a few moments and understand that you're going to be more productive on the back end.
Too hard for too long, I feel like, is important.
Yeah.
Like, if you work too hard for too long, because you can work too hard for 2 hours, you know, but take an hour after.
Absolutely.
I want to make sure we cover everything from an Optum standpoint. I know you're an Optum provider. What do you guys have coming up here in like the short, near-term future?
Right. So this is Medicare enrollment season, and it started back in October, but it's going to go all the way through the 7th of December. So this is the time to enroll. Finding a licensed agent is the best way to do it. You sit down with them, and they can discuss with you what your needs and preferences and things are, and they can find the plan that's best for you, because there is no one-size-fits-all plan, right? So it's gonna depend on your various needs with regard to pharmacy services and lab services and hospital and various things like that. So they can help you find whatever plan is best for you. And this is the time to do it, and that is a really good reason, what we've talked about today, to pair up with Optum if one is dealing with mental health issues, because that's a huge benefit and focus that we have is making sure you're squared away in that regard.
Yeah, I've really, you know, you've come on before and I really enjoy this conversation, but, you know, not to talk poorly about anybody, but I feel like there's like a misunderstanding with, you know, medical professionals or big pharmacy, big whatever. They like, at least this is my misunderstanding. It's like they're too big to care about, you know, the little guy.
Right.
But you as an individual, and you represent Optum, you've explained to me that you guys really do care, you know, down to the lowest level, to where you're taking care of yourself at home. So you can come in and you have a patient that comes in and they have a family issue, and you're talking to them about childhood trauma, and they came in for a, you know, diabetic appointment.
Right.
That is like absolutely moving for me. So I want to applaud you and Optum for being that personal medical experience that we all crave, because no one likes going to the doctor. No one likes going to the dentist, especially when, you know, I feel like I'm talking to a robot, you know? So just to share your story and share what you've been through, it just gives it more context, and it means more that way.
Absolutely. Yeah.
Well, I put you on the spot last time. Do you remember the story you told me about the guy passing out in formation? But we always do a story.
Yeah, right.
We always do a story at the end. So if you want to tell a story from like your flight surgeon days, or, you know, just a time you were in the military that would resonate with some listeners.
I would. There's one. I just go with whatever pops in my head. So
Good.
this may connect with someone. I remember being down at Brooks Air Force Base for flight surgeon training, and we were having our big centrifuge training coming up, where we're supposed to qualify for our aircraft.
Okay.
So if you're flying a heavy like a C-130 or something like that, then you only need to qualify up to 6 Gs or whatever it is. But if you're going to be working with a fighter squadron, then you need to qualify. I think it was 8 Gs.
Oh, centrifuge training. This is where you get spun and you experience G-forces?
Yeah,
Holy cow.
Correct. So you and I are like the exact wrong build for like going up above 6 Gs.
Right.
Because, G-lock is basically G-force induced loss of consciousness. As you're whipping around this thing, whatever speed it is, all the blood and everything kind of leaves your brain and your upper body, and it pulls down your legs, right? Mm-hmm. So you have to put on this thing called a G-suit, which is like this sort of harness-looking thing on your lower body, and they pump it up so that it really squeezes the blood up from your legs, and you have to go and do this specific breathing exercise. Mm-hmm. A lot of examples of that, if anyone has ever seen the most recent Top Gun movie. Okay. So you actually see them go into those breathing exercises to kind of keep that blood up to your head. And I've never felt so close to feeling like I was going to just die as I was inside of like a centrifuge, because you get into this thing and it starts whipping around and your sense of equilibrium and everything is completely off. Mm. So you feel like you're tumbling forward and twirling sort of laterally like this at the same time, and you're trying to breathe properly and keep the blood from leaving your brain and going down into your body. So you're tensing your legs and you're kind of gripping the sides of the chair, and and this guy is coaching you as you're going through, and he's telling you, okay, you're up to 2 Gs, you're up to 3 Gs, okay, all right, keep breathing, hold on, get on top of it, okay, breathe, 4 Gs, 5 Gs. So I was able to make it up to 6 by God's grace, and one of my coworkers, not coworkers, but co-classmates, who incidentally works for a different medical company in town, just down the street from where I live now, actually. Okay. She works literally 2 blocks away from where I live. She ended up actually popping. So she ended up throwing up all over the place inside the module, because she had to go up to 8 Gs. Oh, geez. But she's really short and compact, so she stayed awake. Okay. But she just ended up like throwing up everywhere. So so that was something we could kind of razz her about, and I was amazed. I was like, "You're a machine," because I would have passed out. Yeah, for sure. So that's an experience that's always kind of stuck with me, and it's that was down in Texas, and it's just weird that now she's like a colleague of mine here in town, and she's.
That is small world. I've seen so many videos of that. I would be absolutely terrified to get in one of those.
Those are great. Like, those are fun videos to watch. If you ever,
the videos are fun. I'm talking about if I was in the moment, it's time for this day of training.
Oh, it's terrible.
Terrifying.
Yeah, it's terrible. I would never do it again.
Yeah. Give me a perspective though. 6 Gs, 8 Gs. What's like? Give me a range of like what someone experiences, while turning left on the highway versus, pulling up an F-16.
Oh, absolutely. I mean, if any pilots are listen to this, they're probably going to be like, "Oh, you got this wrong." But I would say probably, let's say you're cruising along in a car at like 70 miles an hour, and then there's a sudden, increase to the incline. Right. That would probably be equivalent of like 1 or 2 Gs where you're like thrown forward. Yeah. Do you know what I mean? Yep. Like you feel like there's enough of a bump or something where you can't sit up straight. Like your whole body gets thrown forward and you can't control it. That would probably be like maybe 1 to 2 Gs. So this is the sort of thing where it feels like you're being compressed by like an invisible force, which I guess you are.
For sure. Yeah. Interesting, man. I have no perspective of like the whole, flight pilot area. So it's just cool to hear about.
It was fun. I really enjoyed that experience.
Cool.
Yeah.
Well, I appreciate everything you shared with us today. You have really good insight. Both of our conversations have been really insightful, both for me and our listeners. So I just want to thank you personally on behalf of the Veterans Voice podcast and Mount Carmel. You just have a really good perspective from a provider's standpoint.
Well, thank you so much for having me. It's such a pleasure. I've never done an in-person podcast with someone else. I've kind of done my own thing on the side, but I've never. So this is my first one. So it's just such a pleasure. Thank you for having me on.
Sure.
I really appreciate it.
We'll make it a thing.
Absolutely.